Let me just start by introducing myself. So I'm Chirag, and right now I'm a high school student. I'm a junior, so started a website called Medical Blogs, which it's a website that educates people on numerous diseases and disorders. And I thought of starting it because I was more interested in learning about medicine. So, yeah, can you introduce yourself?
Yeah, so my name is Sadaf Sareshwala. I grew up in the Bay Area of San Francisco. I went to undergraduate at UC Berkeley, where I did a public health degree with a global poverty minor. I then went to Touro University Medical School, where I ended up getting my DO degree, which is the medical degree. And then I went to residency at University of California, Irvine, down in Southern California. I spent 3 years there, was a chief resident while I was there. And then upon graduating from residency, I got my family medicine job here up in Sacramento, California with Kaiser Permanente.
First question is can you describe your role as a family medicine physician and what made you choose family medicine?
Yeah. So a family medicine physician is your primary care doctor, the one you see, when you go to the clinic, you want to basically they're your coach. They're your person who sticks with you for everything. And then if you need more specialized care, they're the ones that you talk to then refer out to maybe cardiology or nephrology. But a lot of primary care doctors end up managing a lot of things, a lot of very chronic diseases on their own. And the reason I loved family medicine is because I could literally take care of everybody from it's a kind of a morbid saying but from cradle to coffin. So I have gotten training in delivering babies. I also help people through their prenatal care. I take care of their kids. I take care of teenagers, adults, all the way. I've helped people pass away. So I kind of take care of the whole gamut, all of life. So that part's very rewarding because you can take care of somebody who has a baby, and then you take care of that baby too, and you take care of their spouse and their grandparent. And so it's very rewarding to be a true family physician where you get to see everybody in the family and manage all their medical conditions. So I personally chose family medicine because I wanted to be the kind of doctor that no matter where you put me into, no matter what scenario, what situation, I would be trained for it. And it's kind of awesome to have so much training in every single phase of life. So it's fun because every time I walk in through the door, I don't know what I'm going to find. Am I going to see like a baby who just needs their newborn exam, or am I going to find someone suffering from a heart attack, or somebody with diabetes? There's so many different things. So family medicine for me really helped me encompass all of that. And I have a special interest in teaching. So family medicine is great because I get to kind of carve my own niche in many, many different areas.
The next question we are arriving at is what inspired you to become a doctor and not a nurse or a PA or any other profession in healthcare?
Yeah, so I will tell you a story because I love all the nurses I've met and worked with, nurse practitioners, PAs, which are now called physician associates. They are all phenomenally intelligent people. And medicine is a team. We all work in a team. It's almost like a big, giant group project. Um, but for me specifically, I went to the slums of Mumbai, India, as part of my college capstone project. And while I was there, I saw that a lot of the decision making that was happening, and a lot of the patients were doctor. And so I came back over here and I noticed that our system, the way it's set up as well, is it's a big team, but at the leader of that team is usually the physician, the doctor. And I liked that. I liked that in this group project, which is health. And then I think another, what is your limitations? What is your training? And nurse at that level, same with the PA, same with the physician assistant. But and there's really no glass ceiling, and that have to have someone signing off on my notes or having any kind of oversight, getting the training I needed. It's essentially a decade of training. So when I come into that patient room, I feel ready to deal with whatever problem is in front of me and tackle whatever issue they bring up to me. So that's why I chose to be a physician. But like I said, it is a team work. It's teamwork. So I could definitely not do the job that nurses do or PAs do, but I enjoy the scope of practice that physicians have.
Thank you. So yeah, that is really great answer. And the next question is, what's the difference between DO and MD? I'm still a little confused because I do know that DO is more of a holistic approach and they have more training, but I'm still a little confused on why they're giving extra training.
Yeah. So DOs, which is called Doctor of Osteopathy, receive all the same medical training that an MD would receive. They get all the biophysiology, all the anatomy, everything. In addition to that training, we also get some extra points. So one of them is called manual medicine. So it's called osteopathic manipulative method, OMM or OMT. With that, we're taught and trained how to use our hands to treat. So not only is it treatment, but also diagnosis. So for example, if you were to walk in with a virus, right? Hopefully not COVID, but just like a normal viral illness, runny nose, cough, and all that. A physician may tell you this is a virus, we can't do anything for it, drink a lot of fluids, rest. As a DO, we get extra training in the lymphatic system. So I could actually manipulate with my hands your sinuses on your face, work on your lymphatic system to help the drainage and get your lymph nodes working more efficiently. And so we've actually done some projects in this. Like there's research going on with people who are, say, post-surgery. They can't walk, they can't run around, they're just kind of laying in bed. And in order to help recovery, people have tried OMM and OMT, and they found that they've actually been discharged faster. They get treated faster. So it's a cool arsenal in my tool belt. It's an extra training that I've gotten, and I've seen in my MD friends, for example. I can't speak to all MD schools, but in the friends I have, they used to have school or classes from 8 a.m. to noon, and then after that they would go and study. But as a DO, I would have classes 8 a.m. to noon, 1 p.m. to 5 p.m. with the X approach. And so it is holistic. The goal is just have to kind of help the body, but the body will get there on its own.
Yeah, so the next question is, what are some issues you see the most in family medicine?
Family medicine is a very wide. Specifically, I see a lot of diabetes and heart issues. But then I will also see just like routine healthcare things like women coming to me for contraception, many people who do. But on a daily basis, I also deal with people having urinary tract infections, addiction. So people who are maybe addicted to smoking or alcohol or even other drugs. My average day is just so varied that it's hard to put just like one thing that I see. But I think if I were to say one thing that I see a lot of, it's going to be a lot of this chronic healthcare issues like diabetes, high blood pressure, cholesterol issues, kidney function issues, a lot of full body physicals just to make sure everyone's doing okay, going back to school or work. Yeah, lots of counseling too. I do a lot of medication management, but also counseling in terms of how to eat better, how to exercise better. Yeah.
Cool. So the next question is, if you were in the medicine school admissions committee, what would be an ideal candidate for you?
As a medical student, I would say the ideal candidate is somebody who can work well in a team, who's caring and is ready to work hard. I think medicine is one of those places where it's sheer number of hours that you can put in, and that's what's going to get you in medical school. So if I was on an admissions committee, I would look for somebody who has the ability to and the drive to want to put in a lot of time, a lot of energy into really learning the material, learning disease processes. All of those things are very teachable. The thing that's not teachable is true human kindness and compassion and the ability to work well with others. As mentioned earlier, medicine is such a team sport. It's like you can't take care of a patient without so many other players.
Sure. So the next question is similar to the question I asked you right now, but can you give any advice for the future medical doctors or any future healthcare professionals?
For future medical professionals, I would say, it's a long road. It will be hard, and there will be times that you feel like you're not doing enough or you're not smart enough. But I think everyone should know that if you want to be in a position where you're helping patients in the room where people are, divulging their most sensitive and personal things, your hard work will not go unrewarded. I think healthcare is a hard, difficult field, but it's also so um, rewarding in the sense that you get to be holding the hand of somebody who is in their most vulnerable, naive position. I've been in the room as someone has passed away. I've been in the room as someone was born. These are very extreme emotions, right? I've in one day during residency, in the morning I was in newborn nursery, and in the afternoon I was doing palliative care. So in one day, in the morning I helped bring a baby into the world, and in the afternoon I helped put someone on comfort care and help them pass. And those are very extreme emotions, like to go through that every day. So medicine is such a roller coaster, but it's so rewarding to be able to be there for your patients. And I think the harder you work, if you want to be a doctor, the harder you work in high school, in college, in medical school. What's cool about medicine is nothing is wasted. There's going to be a patient where that piece of knowledge will come in handy and really help their life. And I think that's phenomenal. Like the fact that my one random experience that I may have had, or that random chapter I read, can then change someone's livelihood or change someone's life is really cool. And I think that part of medicine is amazing, that no matter what you do, no matter how hard you work, it is going to pay off. So I think for everybody who is trying to go into healthcare, it doesn't even have to be into medicine. It could be pharmacy, it could be in like as a nurse, anyone working with people. I think that it's just such a rewarding place to be, that all your hard work does pay off.
Yes, I totally agree with you. Are in their life-changing moments, and you really make an impact. So I think it's really tough job, but it's a very rewarding experience.
Yeah.
So our next question is, if given a superpower, what would be the one thing you would change in medicine?
Yeah. So medicine is not a perfect career at either, right? It's not a, it's, there's, you're dealing with very messy, like I said, it's a roller coaster. Like you're dealing with people at their worst. But I think that if I could take away one thing to make my life easier, it would probably be dealing with these insurance companies and the notes that we have to write. I wish that I could just see my patients, give them my advice, and then walk out of the room. But unfortunately, that's not the system we live in. So I would definitely need like a magic wand to cure that system. But I think it would solve a lot of physician burnout. I think that a lot of paperwork and some of this extra, hoops that you have to jump through as a doctor in order to get your patients the best care can be really frustrating. And a lot of people who are going into medicine don't know what that is. So I would really recommend anyone in high school or college who is looking into healthcare to definitely shadow a doctor, because it makes a difference to actually see what they do day to day and what their job entails, what their day entails, because it really helps to know what you're getting into before you're, already in there. So you said, are there any procedures that we have to do in family medicine? Well, there are standard guidelines that inform all family physicians so that we can be consistent. So if you were to see a family physician here in Sacramento, you would see me, and then you went to, say, Utah, you should get the same care. So there is a standardized like treatment approach. There is a right answer to how you're supposed to treat things, and there's regulatory committees. Like there's this there are committees that tell you what are the guidelines. Like, for example, for a urinary tract infection, every family medicine physician, every physician would follow the same guidelines. So, for example, we get their symptoms. We think, okay, these symptoms are consistent with urinary tract infection. We get a urinalysis, so we check their urine for bacteria, and then based on what the bacteria results are, we know what the proven antibiotics are for those specific bacteria. So we will give them the antibiotic that's appropriate. So going this like step-by-step method is what our training taught us. So like I said, the medical school, the residency, we're all taught in the same way, and we're all taught to be evidence-based. So if there's any research that comes out that is showing that there's a better way to do something, then all doctors are expected to follow that research, and we're all expected it depends on your program, it depends on your field, but every 2 to 3 years we all go through a recertification process where we take tests again, and we do this thing called continual medical education, CME credits, where we're constantly learning about what are we supposed to do, how are we supposed to treat, what is the new science that's come up. So doctors are all supposed to be on the same page. I mean, given that there are these kind of like things that we're supposed to approach with, there is some, room to do with your own experience as well. But for the most part, we all are supposed to follow evidence-based guidelines that tell us how to manage medicine, because it's very easy to say, oh, like that guy ate this and he got better, so I'm just going to do it for this guy. But that's not how medicine works. We have to do things that are, in studies that thousands of people have had this intervention and they've done better with, and that's why we would use that intervention.
So the last question is, how do you define a great doctor?
A great doctor. Well, my definition of a great doctor is somebody who is a guide to their patients to meet their patients' goals. I think that everything should be patient-centered. I think that we are consultants, but we're not the patient themselves. We're not living their life. So my goal in being a doctor is to be able to kind of explain what's going on, but then use the motivations and patients' goals to really help them live healthier lives. And I think that makes a great doctor, someone who listens, someone who knows the patient and what their goals are, and what their goals are for not only their health, but what their family life is like, and what their income is like, where the neighborhoods they live in. Because it would be silly for me as a doctor to say, eat like these kind of vegetables all the time and exercise like this, when somebody's like, hey, like the closest grocery store to me is a gas station and I can't exercise outside because there's a freeway there, And so I think a good doctor is someone who takes into account all these components, these other determinants of health, and brings them together, and then creates a plan for that patient based on what the patient can do and what the patient's goals are. So I think that makes an ideal doctor.
Interesting. So it's a follow-up question. So I had a class in ninth grade, and it said that there are many food deserts in the US. So there aren't many grocery stores or many organic vegetables sold near their homes. So that really lacks their nutritional daily value. So what would you do to prevent health compromising?
And it's a huge issue. I mean, I'm bringing in kind of my public health and global poverty background into this as well. There are whole communities that don't have, fresh fruit and vegetables. So there are a lot of community partners that are helping out food pantries and food kitchens that do have these kind of vegetables offered. And I know my clinic in residency used to do a Saturday morning food pantry where people would just line up and they could take a box of fruits and vegetables. And so the clinic, like I as a doctor, could write a prescription saying that they should get to the front of the line so that they can get these free fruits and vegetables. So I think when a patient is living in these kind of situations, we have to really rely, like I said, teamwork. We have to rely on community-based outreach, community like grassroots initiatives, because there are things out there. There are food pantries that are providing fruits and vegetables for patients, and it's important for me to then connect them with maybe a social worker or somebody who works in the community that can help them find the fruits and vegetables they need. And like I said, like as a doctor, I can't do all of that, so I need my teammates, and I need to be aware of what kind of opportunities or um, uh, things are in our community that they can use. So that's what I would do. I would try to figure out what are the opportunities in our community, what are our neighbors working on, what kind of initiatives are going on within our city itself, and connect my patient with these so that they can get the nutrition and the health that they are seeking.
Thank you for such a great answer. So yeah, we're done with the interview. Do you have anything to say or any feedback for the interview?
No, I think that it's really exciting to see high school student like you looking into medicine so early. I think medicine is one of those things that it is a long road, and a lot of people either know they want to be a doctor or they don't know till later. But it doesn't matter what time you decide. I have friends who applied to medical school, realized that they didn't want to be their career when they were like 35, and then applied to undergrad or applied to medical school, got into residency. And there's no age limit. You don't have to say like, when I'm this age, this is when I have to decide. So it's really cool to see you starting so early, and I hope that something I shared today is of some help to other viewers. So
No, your interview was really helpful, and I'm sure people will find it very helpful for when they're pursuing healthcare in future. So yeah, thank you for attending this interview. I was very honored to speak and have you as a guest, and I'm looking forward to having more collaborations with you in future.
yeah, it was a privilege. It was a privilege to be invited to be interviewed. And I hope if anyone has any questions, they can also follow my blog on Instagram. It's Dr. Sadaf Sareshwala. So I post a lot of cool things about medicine and healthcare in general. And maybe I'll throw in some posts about how I got here and what's the process like. I'm happy to help. I'm happy to mentor as well. Part of the reason that I'm a doctor today is because of all the people who gave me advice and all the mentorship I've gotten along the way. So good luck to you. And I hope to see you as a future doctor, one of my colleagues in the future.
Thank you.